Recently, a couple came to me from the US for a consultation for conception. So they have been married since the last 8 years and have been actively trying since the last 7 years. They have tried IUI multiple times and couple of times they tried IVF and then they couldn't conceive. After 6 months of Ayurvedic conception program, they conceived naturally. And in this video, I am going to share with you everything that I have done with the patients to make sure that they conceive. Before we get into the treatment of infertility, let us understand what is infertility. Infertility is basically if you are trying actively for a year and you are not able to conceive, that is called infertility according to Ayurveda. Now I'll explain to you few factors that are extremely important to fertility in no particular order. Number one is age. These days most of the couples that come to me start trying very late, by 37, 38, 39, sometimes even 40. And when I ask them these questions, what made you so late? Most of the time the answer is, they are not sure whether they wanted to have a baby or not. Sometimes they are not sure of the partner. Sometimes they are not sure of their job, whether this job is going to be there. Am I earning well? Am I settled properly to have a baby? In today's competitive, busy life where we don't have assurance or surety about anything in the world, things like this happen. But if you really want to conceive, please start trying early. Please make those decisions which you are delaying early so that you don't find it difficult to conceive later when you decide it. Why is the age important? In every female, we have an egg reserve. This is measured by a value called AMH or anti-Mullerian hormone. When this value goes low, less than 0.5, 0.2, 0.3, 0.1, 0, then the chances of conceiving is much lesser. Your fertility is coming down. With every passing year, your AMH level gets reduced. That is why it is important to start early. Having said that AMH is extremely important for conception, there are people who have had 0.4 AMH, 0.3 AMH, 0.5 AMH who has conceived. Because in addition to AMH, we also look at the follicle size, the number of follicles, because all of these are parameters which are important for your conception. Another thing is your FSH-LH ratio. This is your follicle stimulating hormone and your luteinizing hormone. The ratio should be less than 3 for conception. If you're somebody with hypothyroidism or Hashimoto's thyroiditis, you have to make sure that you bring your values down to less than 3. If you have polycystic ovaries, you have to work on that. If you have endometriosis, it can affect your fertility. So you have to try hard to conceive. At least 50% of people with endometriosis after delivery, there are chances that you don't get endometriosis. So conception is good for a patient with endometriosis. But if you have endometriosis, conception is a little difficult. And some people have irregular menstrual periods. That needs to be corrected. Some people don't have menstruation, primary or secondary amenorrhea, where you don't have periods coming every month. In such cases, we have to find out if they are ovulating or not ovulating. If you are not ovulating and not having periods, then that is a serious condition that you need to correct. These conditions have to be corrected before you conceive, because if you are somebody with hypothyroidism and you are conceiving, your chances of maintaining that pregnancy is lower compared to somebody without hypothyroidism. So we have to first correct or bring down these conditions and then start the conception program. All of these abnormalities can be corrected with Ayurveda in 3 or 4 months. What is Ayurvedic Conception Program? Unlike modern conception treatments like IUI, IVF, etc., Ayurvedic conception treatment is not about inducing pregnancy. What we are doing is we are trying to create the environment right inside the womb of the female and also improving the fertility of male, so that when the sperm comes, your egg is ready to conceive and take action. And how we do it? Ayurveda says that conception happens when we optimize few parameters. So the first parameter is the ovum and the sperm and the quality of it. This has to be enhanced. That means if there is any imbalances, vata, pitta or kapha imbalances, the egg of the female or in the sperm of the male, we have to first correct it and improve the quality of it. The second one is Ritukala, and when the follicle releases the egg, that is important. The third one is Kshetra. So Kshetra is where the fertilization and implantation happens. So that is the internal environment inside the womb of the mother. Ambu is nourishment. The nourishment of the internal environment is very important. If a seed has to grow into a plant, we have to give the right amount of sunlight, some moisture, water, air, everything has to be optimal. So in the same way, inside the womb, we are creating such an environment when the sperm comes inside, we are ready to fertilize it, and then once fertilized, we are ready to implant it in a most healthy way. Since now you have a basic understanding of the Ayurvedic principles around fertility, let me explain to you what actually helped with this couple. So one of the patients had a Pitta Prakriti. Pitta Prakriti means the patient had acidity, acid reflux, heartburn. The patient had skin issues, patient had elevated cholesterol, patient had mouth ulcers, all of those conditions were present in the patient. So the patient was a Pitta Prakriti patient. If you see a male human body, you will see the testicles are hanging outside the body and not inside the body. It is in the testicles, inside the scrotum, the sperm is produced. The testicles hang outside the body because the temperature inside the testicles has to be maintained 2 degrees less than the body's core temperature, because that helps in spermatogenesis, maintaining the health of sperms, etc. So when a person is already a Pitta Prakriti person with a lot of heat imbalances in the body, naturally the sperm will not be optimal quality. So the first thing that we did with Ayurvedic treatment was to reduce the heat in the body by including foods that are cooling. We included black raisins, we included grapes, we included ash gourd, we included many of those things that reduces the Pitta in the body. To further reduce the Pitta in the body, I gave something called Thaneka Hima, which is called cold coriander infusion. So you basically take 1 tablespoon of coriander seeds, add hot water to it, and then leave it overnight. Next day morning, you drink that water first thing in the morning. We also gave him concentrated amla juice and ash gourd juice. Again, it's in the form of a shot, not a full glass, because full glass can increase the vata in the body. We shouldn't do that. So a short glass of amla juice and ash gourd juice were given, along with mishri added. Mishri is rock sugar and it is again cooling. Along with that, based on the patient's different dhatus, doshas, malas, saras, everything, considering all of that, we also made some medicines in the clinic individualized to the patient and given to the patient to reduce the pitta in the body and to improve the sperm health. In addition, to improve the fertility further, we also gave him an oil called Gandharvastha Eranda Thailam, which is an oil that we give to improve the vata in the body, and this was given every night. So this was the treatment protocol for the male. Now coming to the female already had endometriosis. So the treatment for endometriosis was done in the first 3 months and the patient was already having Pitta Prakriti body. The conception treatment is with warm medicines, because in conception treatment we do vata reducing treatment. So first we have to cool down the body of the patient and then introduce the warm medicines, because if we directly start with a warming medicine, the patient will be on fire and then they will blame Ayurveda, this Ayurvedic medicines are heating, etc. So we didn't give that. In the first 3 months we took our time to reduce the heat in the body slowly and steadily, work on the endometriosis, correct the menstruation, and in the 3rd month we introduced the Ayurvedic treatment for conception. Now the treatment for conception is primarily to reduce the kapha in the body and majorly to reduce the vata in the body, because vata is one thing that comes in between you and your fertility. So we have to reduce the vata. So how to reduce vata? The patient was asked to do abhyanga or oil massages every single day during the 3 months, and this was with organic black sesame oil, and the patient was also asked to do svedana, that means steaming after the oil massages. If you are somebody listening to this and you want to do that steaming, and if you don't have a steam machine at home, you can always dip a towel in hot water and use that steam in the body. Now that is one thing that the patient started doing in the morning. We included seeds like sesame seeds and dill seeds in the diet, because these two things are extremely vata subsiding and helps reduce the vata in the body and helps optimize the patient's body for conception. In addition to this, we also gave some medicines that we custom made for the patient based on her imbalances, and that was also given along with the treatment. The patient had tubal blockage, so we had to reduce the tubal blockage with the help of a treatment called Uttaravasti. During the 7 days that she stayed in the hospital, we gave Uttaravasti to open up the tubes. After the treatment, the patient was asked to take proper rest for the next 2 days, and then the patient was sent home to continue with the diet, lifestyle and all the routines which were advised to the patient. Just now I realized that I missed the most important part of the treatment. What is the most important part of the treatment for anybody who wants to try to conceive? It is intercourse. So Ayurvedically, we don't count the ovulation days or we wait for the ovulation day to happen and then we have intercourse. Ayurveda says that after 7th day of periods, every day is your chance to conceive. So the patients were asked to have intercourse at least 3 times every week after the 7th day of period until the next period. And now we have come to the last part of treatment. In Ayurveda, we have something called Artha Chikitsa. That means when diet, lifestyle, routines, your medicines, everything becomes 50% of your treatment, the other 50% of the treatment is this treatment called Vasti. Vasti is the ultimate treatment to reduce the Vata in the body. And because Vata is subsided, both Pitta and Kapha also subside. So it is considered the most important treatment in Ayurveda and the most important treatment for conception. So during the final leg of the treatment, which is Vasti, we did a particular Vasti called Yoga Vasti, where the patients were subjected to combination sessions of oil Vasti and Kashaya Vasti. Kashaya Vasti is a decoction Vasti. The oil Vasti is with oil and Kashaya Vasti is with decoction. Oil Vasti is much more milder, Kashaya Vasti is much more stronger and complicated. Even how we mix the medicines are important, so don't try Kashaya Vasti at home at all. Both of these Vastis have a whole lot of things to be followed as a protocol, and in another video I will explain to you how to do Sneha Vasti. So after the 7 days of Vasti, the patients were sent home and they were asked to take 7 days of rest at home, and then they continued the medicines and started trying. After 1.5 months, they conceived naturally. So if you are someone or you know of someone who is trying hard to get pregnant and it is not happening, before going to invasive methods and before going to hormonal methods, always do remember that there is this beautiful system called Ayurveda. Without any harm to the body, without no harmful chemicals, nothing, you can get pregnant naturally. Before I finish this video, I want to tell you one thing that I tell all my patients who come for conception. Always remember, 95% of your results is in your hands, where you do the right thing, you follow the diet, you follow the protocols, you give your 100% and strongly believe that this is going to work. So leave that 5% up to the universe, whether it is going to happen, not happening. We are not bothered about it. However, to do the karma is the most important thing. What we have to do, we have to do. So follow the diet, follow the medicines, follow the treatment protocol. Believe that it is going to happen. It will happen.